My name is Ian Alonjung, and today I'm going to be assessing the head, the ears, the eyes, the neck, the thyroid, the cardiovascular and peripheral vascular system. So before anything, I'm going to wash my hands. I'm going to dry them off before I put my gloves on. So I decided to use vinyl gloves because my patient is allergic to latex gloves. Hi, how are you doing? My name is Dr. Ian Alonjung. So what brings you here today?
Hello, I'm doing fine, and I'm just here for a regular checkup.
You're here for a regular checkup?
Mm-hmm.
Okay, so just give me one moment. Let me close the door to ensure your privacy.
Thank you, I appreciate that.
All right, so I have a few questions for you, ma'am. So to start off, how are you feeling today?
I'm feeling all right.
You're
Thank
feeling
you
all
for
right?
asking.
Okay, so what is your first name, your last name, and your date of birth?
So my first name is Michelle, my last name is Holiday, and my date of birth is 12/16/1997.
All right, so Michelle, Holiday, and your date of birth is, could you say that one more time?
12/16/1997.
Okay. Okay, perfect. So today what we're gonna do is we're gonna assess your ears, your eyes, your throat, your thyroid, your cardiovascular, and your peripheral nervous system. Are you gonna be comfortable with any of those?
Yes.
Okay, that's perfect. So let's get started. All right, so I'm gonna take your temperature. So if you could please open your mouth.
Mm-hmm.
Okay, perfect. Okay, your temperature is a 94.2. That's not so bad. 92. Okay, so now what I'm about to do is Okay, so now I'm gonna take your blood pressure. All right, so if you could just roll up your sleeve. Thank you. All right, I'm gonna try to make it firm, but not too firm so you don't feel any unnecessary pressure. Okay, perfect. Could you hold this for me, please?
Sure.
Thank you. All right, just trying to look for one of your arteries. Okay, there it is. Perfect. All right. All right, Miss Holiday. Do you mind if I call you Miss Holiday?
Yeah.
Okay, perfect. So what I'm about to do is an assessment of your skull, your forehead, and your jaw. So what it's going to involve is me just pretty much checking if you have any lice or indentations. I hope you're going to be 100% comfortable with that?
Yeah.
Okay, perfect. All right, so don't mind me. Let's see. Okay, everything seems okay. Do you sleep on the back or the front side?
The back side.
The back side? Okay. Okay, that's perfect. All right. Okay, so what I want you to do is just open your mouth. Okay. And I want you to. Okay, so just add a little bit of resistance to it. Okay, perfect. Okay, so I'm just gonna feel. Okay, so I want you to tighten your teeth. Okay, that feels normal. Tighten your teeth again. Okay. Okay. All right, perfect. I think you should be all right. You should be good in this area. All right, ma'am. So what I'm going to do is I'm going to assess your nose. So now what I'd like you to do is take one finger and then put it on one of your nostrils, and I want you to breathe from the opposite nostril. Breathe in, and then breathe out. Perfect. All right, and then do it with the other one. Okay, perfect. And just out of curiosity, do you suffer from any sinuses of your nose of any sort? No? Okay. So what I'm going to do is I'm going to check your nose to see if there's, let's see. Okay. Okay, it looks clear. It looks good. Okay, perfect. All right, Miss Holiday, so the next assessment we're going to do is we're going to check your sinus pressure. So if you don't mind me just Massaging your face a little bit, like that. Okay. Do you feel any tenderness? Okay. Any tenderness?
No.
No? Okay. Okay. Alright, so for the next assessment, I'm going to be assessing your mouth and your pharynx. So the first thing I want you to do is just to stick your tongue out as wide as it can. Okay, perfect. Now I want you to move it to the left, to the right, up, down. Okay, perfect. So now would like you to open your mouth, please. Alright. Okay. Alright, perfect. Alright, so the next part of our assessment is I'm going to inspect your lymph nodes. So if you don't mind me just putting my hands around your certain areas of your head, if that's okay? Okay, so. Alright. Okay. Okay. Alright. Alright. Okay. It seems normal. Do you feel any pain of any sort?
No pain.
Okay. And any pain?
No pain.
Still no pain? Okay, perfect. Okay, that should be good. Alright, so the next assessment is going to involve your eyes. So basically what I'm going to do is I'm going to take this and I want you to just observe it. Like, do not move your head. I want you to just pay attention to it. There we go. Okay. Okay, perfect. So the next thing I'm going to do is I'm going to check how your pupils dilate. So I'm not going to shine it directly into your eyes, so. Okay. That looks good. Let me check the other one. Okay, perfect. All right, so the next thing I want you to do is there's a couple of words right there, and I just want you to read the fifth sentence. So go for it.
So it is PEMDAS.
Okay, perfect. Now I want you to cover your other eye and just say the exact same thing.
PEDMAS.
Awesome. And so the next thing I'm going to do is I'm going to check your eye muscles. So I'll be as gentle as possible. Okay. So move it up, down, left, right. Okay. Do you feel any pressure, any pain?
No.
Okay. All right. Perfect. So the last thing for your eye exercise is I'm going to bring this close to you just to see. Okay. All right. Perfect. Miss Holiday, so the next assessment is I'm going to be assessing your ears. Now the first thing I'm going to do is I'm going to have to palpate your ears. So I hope you don't mind me just pulling and stretching your ears.
Mm-hmm.
That's okay? Okay. Okay. Do you feel any pain, any pressure?
No, sir.
All right, let me check your other ear. All right. Okay. All right. So I'm going to check your ears. Okay. All right, perfect. All right, so what I'm going to do is I'm going to put my fingers on one of your ears and I'm going to say something and you're going to hear it from the opposite ear and tell me what you hear. All right. All right, so I'm going to, let me see. Cheeseburgers.
Cheeseburger.
Okay.
Justin Bieber.
Okay, perfect. It seems like your ears are pretty good. All right, so the next assessment is I'm going to assess your thyroid. So let me take a look. I just want to check to see if there's any swelling. It seems like there's no swelling. Okay, and I'm going to palpate your thyroid. I hope that's going to be okay with you. Okay. Okay, it feels normal. Okay. Okay, ma'am, so the next thing I'm going to assess is your carotid artery. So I'm going to place my fingers right here to check for pulse. Okay. Okay. Okay, perfect. Now I'm going to use this. Okay. Okay. Okay, it's a 2+, and it sounds pretty normal. All right, so for the next part of this assessment, I'm going to be palpating certain sections of your chest cavity and listening to heart sounds. Are you going to be okay with me touching certain sections of your chest?
Yes.
Okay, perfect. All right. Okay. Okay. All right. Okay. All right. Perfect. All right. So the next thing I need you to do is to lean over to on your left hand side,
Okay.
and I'm going to do the exact same thing I did earlier. Okay. So. Okay. Okay. All right. Okay. Perfect. Now I need you to sit back up.
Okay.
And now I'm gonna be listening to your heartbeat. All right. Okay. All right. Awesome. All right, ma'am. So this is the last part of the assessment. So basically what I'm going to do is I'm going to inspect your peripheral vascular system. So the first thing I'm going to do is just going to take a feel as follows. And the next thing I need you to do is to stretch out both your arms for me. So I'm going to check your pulse. Okay. All right, and I'm going to need one of your fingers to check your capillary refill. Okay, that's good. Blood seems to be coming back. You seem to have a 2+ pulse. That seems to be good. All right, so the next pulse I'm going to check is the one right here. Okay, that feels normal. And the next one I'm going to check is right here. Okay, that feels normal. And I'm going to check the one right here. Okay, so in conclusion, it seems like everything seems to be normal. You don't seem to have any abnormalities, so I feel that should be it for today. So if you have any questions or concerns, just feel free to come back by.
Okay, thank you.
All right, have a good one.
Bye-bye.
All right, this marks the end of my assessment, so I'm going to dispose of my gloves. And I'm going to wash my hands.